Hi and welcome back to the Time Then channel. U.S. public health authorities advised wearing masks for medical professionals, nurses, and anyone else caring for influenza patients as soon as it was realized that a more dangerous strain of the flu was rapidly spreading in the fall of 1918. Newspapers released images of disguised nurses and advice on how to make masks at home. Masks were simply one of the non-pharmaceutical therapies or social distancing strategies enacted to control the epidemic, along with closing schools, banning public meetings, and offering advice on behavior modifications. Nevertheless, during the 1918 Spanish flu, many people objected to wearing them, claiming that doing so violated their civil liberties. Even in San Francisco, an anti-mask league was established to oppose the law. It turns out that men required more persuasion than women to follow public health authorities' instructions. Men were the weak links in hygienic discipline during the 1918 pandemic because of actions like spitting, reckless coughing, and other disregard for hygiene, according to a 2010 study that was published in the U.S. National Library of Medicine. To force males to wear masks, public health professionals redefined personal hygiene as a sign of duty and patriotism. The report states that the influenza pandemic offered a teaching moment in which masculine resistance to hygiene rules associated with mothers, schoolmarms, and Sunday school teachers could be replaced with a more modern, manly form of public health steeped in discipline, patriotism, and individual responsibility. The shift from advising mask use for medical professionals to pushing and even mandating mask use in public proceeded gradually and unevenly. Most notably, legislation requiring masks in public were approved in San Francisco, California, as well as other western places like Seattle, Washington, Juneau, Alaska, and Phoenix, Arizona. Infractions may result in citations, fines, and/or jail time. However, suggestions and even laws requiring the use of masks were softened and then repealed within a few weeks as the number of cases and fatalities dropped. Did masks stop the Spanish flu from spreading? When experts examined data from 1918, they came to the conclusion that flu masks did not successfully prevent infection. The American Public Health Association recommended in December 1918 that those who are directly exposed to illness and medical staff, as well as those who work as barbers, dentists, etc., wear suitable masks at all times. The committee did not suggest the broad adoption of this practice since it also determined that the data as to favorable consequences consequent on the obligatory wearing of masks by the entire population at all times was conflicting. The committee did suggest that anyone who chooses to use masks be taught about and encouraged to do so as to how to construct and wear suitable masks. Wilfred Kellogg's 1919 investigation for the California State Board of Health came to the conclusion that mask legislation applied forcibly to entire populations did not reduce cases and deaths, which was supported by comparisons of places with vastly different masking policies. Masks were removed when people went inside to work or socialize, when they were most likely to become infected. Masks were worn most frequently in public, where they were least effective. The case against the mask as a mandatory application measure for epidemic prevention, according to Kellogg, appears to be complete. In a thorough study released in 1921, Warren T. Vaughan stated that the efficacy of face masks is still open to question. The issue is human behavior. Masks were worn until they were filthy and in ways that provided little to no protection. Additionally, mandatory laws did not succeed in overcoming the failure of cooperation on the part of the public. When masks were worn by patients who were already ill or by those who were in close proximity to the victims, such as nurses and doctors, they were found to be effective in 1927, according to Edwin Jordan's groundbreaking research, which was first published as a book and then as a book in the Journal of the American Medical Association. Jordan came to a more hesitant conclusion. The effect of mask wearing among the broader community is not possible to assess, despite the fact that masks are uncomfortable and inconvenient, as anyone who has worn them can testify, and require a significant deal of discipline, self-imposed or other. The Spanish flu's mortality. Around 500 million individuals, or nearly one-third of the world's population, contracted the Spanish flu. Although estimates of the number of infected deaths vary widely, the flu is nevertheless regarded as one of the worst pandemics in history. According to a 1991 estimate, the virus claimed the lives of 25 to 39 million individuals. According to a 2005 estimate, the death toll was 50 million, or roughly 3% of the world's population, and could have reached 100 million, or more than 5%. It has been disputed, but a new evaluation from 2018 pegged the number at over 17 million. These figures represent between 1 and 6% of the 1.8 to 1.9 billion people that inhabit the planet. Please kindly subscribe, like, and comment. thank you for watching. If you liked the video, please kindly subscribe and see you on the next one.